all the well-being of from every side. So this is the one of the part that is related to the diet, because most of the parents have asked me about the diet, which diet I can follow, and what is the process of it, can we get any sheets of that, and is it reliable or not. There are so many diets you have heard about, like GCF, gluten and casein free diet, right? Carbohydrate related diet, ketogenic diet, who is having the epilepsy and fits issues, neurodegenerative, or the autism or the ADHD. There are so many diets, which some of the diets have been introduced by the parents itself only, which I don't know. Okay, so it will be better that if we go or follow any diet for the children, it should be the maintaining on the each and every nutrient of the child. Okay, sometimes we go for the supplements also, and how it will be effective for the behavior and the growth, that is the main theme, right? So for that, it's not about the the date on the calendar that today is April 2nd, that's why we have to go with that, but completely the path is running on. But yeah, for today especially we have opted this topic for you people. Fine. So okay, so before starting for the program or the session, I like to introduce Dr. Sirisha. She done her PhD in the nutrition and dietitian. Okay, and she is the founder of the Aether Diet, and she has the good experience of the 14 years in the premier organizations like Rainbow and Lotus Hospitals, Mamta Medical College, Sydney's Gastro Liver Center, along with the rehabilitation centers and the Apollo Clinic. She also worked with us in the 2019 as a consultant, and still now she is. If there is any requirement, she's every time welcome, and she already supported us in the form of, like, if there is any parents who want the support related to the diet, she always on the touch with us. Okay, still now she is with the contact at the Aditya clinics. Yeah, there she is taking the consultations. If you people want, you can go there also, there will be no problem with that. Okay, so she will be sharing her insights on how diet intervention can support our children's growth and behavior. Okay, please stay. I'm going to keep this. This one is not. Excuse me, just a minute. Regarding the being very calm for the, so other parents, what they do think like we will stop immediately. That is not the correct call, I'm saying. So when it is kid is happily taking, then let them allow. Why you wanted to stop? Okay, so everything will change. Just I wanted to say only one thing: if the kid is tolerating very well, then continue. Don't interrupt with the stopping those kind of food items. Okay, so it will not be same for all kids. Okay, and improve acceptance of the new foods. Maybe gut might not be accept for a next 2 weeks or 3 weeks. After 2 to 3 weeks, it might be set for the kid. Okay, so introducing the new foods and the accepting it is a very, very important for the food, for the kid. Sorry. So kids also will fed up with a different kind of a food. If you are giving the same regular food items, they will fed up. So one thing we need to be changed from our side, or else giving the options within the limits would be helpful for the kids. Okay, and the reducing the mealtime stress. For example, kid is not having the food. Okay, don't rush the kid. Why? Because at that time he or she might not be willing for the take the food. You can try after 2 hours or 3 hours, or else wait for some time. They might not be feeling hunger at that point of time. So if the kid is not accepting the food, means just we need to check, we have given the food, what food we had given in the previous meal, is it digestible easily or else it is taking time, right? So these all parameters we need to be think. Okay, am I clear or else is. And reducing the gut issues. When it comes to the gut issues, we will have so many problems. Okay, people will think, even adults also will have a gut issues. I'm not saying for the kids here. I'm talking about the adults even. Why? Because when your gut is not absolutely good, then your brain axis will affect. Okay, so first of all, we need to be work on gut issues. If we haven't cleared the gut issues, if we are giving the nutrients, then baby gut will not be tolerate. Remember, 100% the whatever the food we are giving, baby gut is not going to be tolerate. Okay, so what are the common issues we saw in our autistic kids? Here, first is constipation. Second thing, diarrhea. Third one is bloating. If the baby is couldn't able to take the food, one of the symptom will you can see in a 1 hour, 1 day, or weekdays. If you are triggering the same food for a long time, baby gut will not be accept. Immediately it will shows as a constipation, diarrhea, means loose stools, and bloating. Something will be there. In a previous slide, I have explained you that food food might not be accepting by the kid. Maybe one of these factors also may place the kid to stopping the having the food, right? Why? Because maybe baby gut is bloated, so that's why he or she couldn't able to take. Okay, so these all things are very important. If he or she has passed, so immediately then we can go with that. It's fine, no problem. Is it? Am I audible, right? Okay. So these three parameters we have to be check it out. Okay, and diet helps by adding the fiber kind of a foods. See, these all I'm giving the just so these all I'm giving as a tips itself. It's not for a common for everyone. I'm saying just again and again I'm telling you this is might be changes kid to kid. Okay, and diet may be helps by adding the fiber. Fiber means fruits. Sometimes fruits will contain high sugars. So those kind of a fruits we need to be exclude from the diet. Why? Because whatever we are thinking, just like uh, giving a fiber to the adding to the food will helps you to resolve the constipation. Sometimes it may be triggers also. Okay, and including the probiotics like curd, yogurt. Curd might be you think it is a dairy product. Okay, when we are taking the curd, that is also has to be toned and pasteurized one. So then it will not be affect the gut much. If you are giving the direct dairy products, it may be affect the baby gut. Okay, and ensuring the adequate fluids. When it comes to the as a adults, we will not take the much liquids. In the similar way, when we compare to the kids, they are not willing to take also. So in such timings we need to give a multiple options to the kids, giving not only the liquid means water, it may be other form of buttermilk, rice kanji, any kind of a liquids will comes under the liquid itself. So in that form we can include. Okay, ensuring better gut health improvement will gives you the mood, behavior, and the comfort zone. If the baby is very comfortable in all these zones, then immediately these mood and the behavioral changes will be there. That comfort zone will be there. For example, if the baby is having the most of the loose stools, then the baby will not be have that much of comfort zone, right? So just giving, if the baby gut health is not at all up to the mark, means it will affect the all these things: mood, behavior, and the comfort zones. Okay. And okay, and correct the nutritional deficiencies. So these kind of kids will have a most of the nutritional deficiencies like iron, calcium, vitamins. So these all nutrients we need to be corrected in a proper manner. Okay.
Is it audible to everyone? Yes. Is that about to? No problem. Without mic,
That's fine.
continue the slides.
No problem. No problem. No issue. No issue. That's fine. Yeah, fine. Just we can switch off that, no? Yeah, you can switch off that. So these all nutrients we need to be corrected. Okay, and this might not be for long time. For example, take example of a vitamin D. If we are giving the long time, that will be overdoses. These corrections has to be done. I hope it will switch off this one. Okay, just you can. Sorry. So first of all, we need to be correct the vitamin deficiencies. That is also one of the major factor. Okay, and giving the balanced diet, like giving a proper food, incorporating the carbs, protein, fats, micronutrients, and the macros. So these all together has to be there in a plate. All together, good amount of fiber has to be there, with including all kind of food items. Okay, so when the baby is having a imbalancing diet, then it will leads to the fatigue, poor growth. Why? Because we are not giving a proper energy to the body, we are not giving the proper fiber, we are not giving the proper protein. So these all will have an effect of growth of the baby. Okay, and cognitive issues. So they couldn't able to. Why? Because the brain is not going to be work in a proper manner. So obviously it will finally affect with the cognitive issues, right? And food always regulates the behavior issues. Okay, when you are, whatever the food you are giving the body, it will calm down. If you are giving a high carbs or else high refined food items, it will triggers the body. Okay, so based on the food, whatever you are giving to the kid, it really shows what the baby behavior is. Okay, when it is balanced, the baby irritability will comes down. When you are giving the balancing the diet, hyperactivity will comes down. And when you are giving the proper food to the baby, mood swings will be happy. The body moving like happily body. If the body is not having the balanced diet, means the body mood swings will be there. Okay, so when whatever the food you are giving to the baby, that means L odd. When you are starting with the proper food, breakfast, when you are giving the breakfast in a proper manner, that will carries throughout the day. Okay, so when you are breaking the fast, you need to be give the balanced diet to the kids. Okay, after that, once the baby get up and you wanted to immediate freshening up and you wanted to rush the baby and you're giving the such kind of foods to the having the fast food, then that effect will be on the next 8 hours, next 12 hours. So whatever the food you are giving to the baby, that is very very important. Okay. And so how the diet will, this is the summary of the whatever the slides we have as of now we have discussed. Supporting the brain and the cognitive functions, and the improving the gut health, correcting the nutrient deficiencies, managing the behavioral and energy levels, and the expanding the food tolerance, food acceptance. Okay. And so as of now, we have seen what are the main food will place. Now we are seeing different kinds of diets for autistic kids. Okay, as a parents, what we think, like we need to give this specific food to the baby and we should avoid. It is not like that. Gluten-free diet sometimes will works. Gluten-free diet might be works for next 2 months or 3 months, not for a throughout the year. Okay, when we are giving only the gluten-free, then other micronutrients might be we are missing. So depending on the baby condition and depending on the baby response, we need to change the diet. How the seasons are going to be changed, and similarly we need to change the diet. It is very very important. We should not stick with a only single diet. Okay, for example, people will think that high like ketogenic diet will suits for the autistic kids. That's a wrong. That will trigger the baby activity. At the same time, the baby mood swings will change. Why? Because body needs a minimal carbs. If we are not giving the minimal carbs to the body, then brain will triggers immediately. So I would say the mother or the father has to be scrutinized what the things are going to be fit for the kid. Upcoming 2 weeks, 3 weeks, or 1 month, it may be a 3 months or it may be a 6 months. Whether it will be suitable for or not, then these all things has to be do it under guidance of expert itself. It should not be like we should not take a call immediately. Why? Because nowadays everybody is having the access of YouTubes and the social media. These all are affecting like anything. See, they will post one comment or something. It will based on their perspective itself. They will give you the solutions for as a community, not as a person. Please remember, it will gives you, even the AI also will not ask you these many questions to the who's taking the inputs, right? Whether the gut is healthy or not, AI doesn't know. Whether the baby mood swings are healthy or not, AI doesn't know. So the things will change everything to the person to person. Please remember, it may be when it comes to the your weight loss or the PCODs or else anything, whatever you wanted to. It may be a triglycerides, cholesterol corrections. It may be all the tips will not be work for everyone. It will not fit into your body. Please rethink whenever you are doing something changes to your body, your baby. Think and take a call. Okay. And so whatever the I would like to say that evidence is like only the gluten free will works for everyone. It is not like that. Only the casein diets will helpful for everyone. This is not like that. When you are giving the mixed, the evidence is also showing that the mixed diet will helps you to growth, repair your cells, giving the good uh, activities. So these all will helps you to giving a, when you are having a imbalancing and the micro nutrients lack in your body, we will not call it as a healthy, right? So when we are giving like a mixed all the together, balancing the diet will helps you lot to growth of the kid growth. Okay, and these all things to be done under the guidance of some expert. I am not saying you should come to me, just you can go and check with the other who's experts especially in these areas. Just do take a advice from the dietitians, just take a call. So whatever the things are going, first of all they will ask you your history, what the baby's condition is, how the baby and is the growth is up to the mark or not. So these all will they will check, and what kind of a things they are going through. Based on that they will make a diet plan, will give it to you. This is what the actual procedures. Okay, when you are taking a diet, just it has to be very careful. That's what I would like to say here. Okay, and practical tips to the parents. Okay, first thing is whatever the new foods you are introducing, so these has to be done it in a slowly, repeatedly. If the food is not suiting for the baby, just wait for the next 3 weeks or 2 weeks or 1 month. Again, you can reintroduce and check for the gut, whether the gut is accepting or not. Or else just wait for the next 2 more months. Then you can check. But stopping the food might not be helpful for kids. And the another thing is, every food we don't need to be stopped. Every food we should not be stopped. Why? Because all the balancing diet will be helps to, again I'm telling you, when you are not balancing the diet, the lag will be there, nutritional lag will be there. So that's why we need to be choose balancing the diet. That's a very very important. And maintain fixed meal timings. Why? Because our body releases the cortisol in particular timings. So at that timings only the food will digest and the nutrients are going to be released. So that's why we need to be pinpointedly go with the timings. That's a very very important. See, for example, if you guys wanted to give a therapy for the baby, if the baby is hunger, what will happen? Baby will not be cooperative at that time. So that day therapy time will be unnecessarily spending the time, wasting the time at that time. So instead of doing that, give a proper meal timing to the baby. Allot some time just for a 15 minutes or 20 minutes, but don't spend much time on unnecessarily feeding the baby. They will have the hunger levels in particular timing, they will have something and they will stop immediately. Afterwards, after 2 hours or 3 hours, you can try again something else. Why you wanted to unnecessarily feeding the baby, waiting, and you will get irritated at that time. Why? Because baby is not having the food, mother is going to be triggered again, right? So spend 15 minutes or 20 minutes for that particular time, wait. If the baby is not having willing to take, just take a break. Just, and another thing is, when you wanted to feed the baby, first of all your tummy has to be filled. That's a very very important. Why? Because if when you are hungry, then you couldn't able to feed the baby, that's nothing is wrong. Why? Because you need to take care of yourself also. That's a very very important. So taking the food before to the baby, it's not a bad thing. I would say that have your food on time and feed the baby. That's a very very important. Okay, offering a small and frequent meals. Before that, I already discussed the same point. Again I'm telling the same point. If the baby is not having the food, just give a break. and again you can start something new. Okay, combine preferred plus new foods. Whenever you wanted to introduce a new food, combine with the which is helpful to whenever the whatever some kids will have some kind of a foods very happily. Combine with that, and you can try. If he is not having, again you have triggered the gut, then again you can wait for a weekdays and again you can start. Okay, last point, but it is a very very important point. Avoid forcing the food. Okay, use positive reinforcement. That's a very very important. Avoid forcing the food. If the baby is not having the food, just leave for a 1 hour or 2 hours. It might be happens in every day, then immediately you need to be take a call from a dietitian. Maybe his gut might not be helpful for to take a food, right? So that's why just you need to be check with all these parameters. Again, I'm recapping the same points. Introducing a new foods with introducing a new foods slowly and repeatedly, and the maintaining the fixed meal timings, small and frequent meals preferred, and the new foods. Avoid forcing. So these are the main guidelines. I would say it's a guidelines for every parent. Okay, so coming to your questions, just I would like to take a more questions from your side. So that's why I prepared very less slides. Okay, so if anybody wants to ask any questions, I'm free to answer you.
You mentioned omega-3, right?
Yes.
So there are vegetarian kids, like they are vegetarians.
Yes.
So we don't get complete form of omega-3 from vegetarian diet.
In vegetarians also there are few options. Like flax seeds will be there, but it doesn't mean that will be suitable for the kid. In such situations, just we can go with some kind of a supplements which is suitable for the, see, all the supplements doses when it comes to the pediatric dosages will be different. Okay, adult dosages will not be suitable for the pediatrics.
But these supplements contain bacteria, right? Omega-3 supplements are very, you should not use for a long time.
That's what I'm telling you. Doses is very important. At the same time, how much time we need to be continue. That is also how much time we need to be reintroducing the timings also very important.
How many, like, for a pediatrician recommended cost is omega-3. So you can continue for 6 months.
Maybe the doctor has been prescribed you for a 2 months or 1 month or 3 months. Just you can check it out with the pediatrician. Why? Because yes.
But how long we should take?
That's what I'm telling you. What is the dosage the doctor has been given? I'm really not sure. And how much time he has to be, he or she has to be supposed to be taken, that will be given prescription itself. The doctor will give you the next 3 months. Yes, that's fine. No problem. If the doctor has, again, if we really requires, then again we can restart. After 2 months or after 3 months, we can start.
Because these seeds and all, they won't be.
Yes, absolutely. They couldn't able to.
But any other thing you can buy?
In vegetarian, I don't think so. Obviously, when it comes to the non-veg options also, all the fish is not will contains omega-3s. For example, if they are taking the one piece in a day, that's really not sufficient. While cooking, few kind of nutrients will evaporate. Why? Because each cooking method might be changes. Person to person it changes. So I'm not saying the supplements has to be placed for everyone, but when it is required, then we have to be.
Nuts can be given, like all.
Nuts we can, but we need to be checked with the kid. When sometimes few nuts might be triggers the baby. So in such situations, we couldn't able to ask parent to.
But in the daytime, you might be eating a lot of variety of foods, but which triggered, which not, how I.
See, if you are introducing the some kind of a food all the day, you will have a recall, right? So sometimes it might be miss. If you are introducing, just you can check it out. That's why we usually say to the parent, maintain a food diary. So if you are getting with a food diary, then we can say these might be that there is a chances. So then we will say just stop these foods and we will look into for next 1 week. Then we can check it out and immediately we can tell these are the main triggering foods. And
Thank you for the session, ma'am. For us. Okay, so my question is, you spoke about adding fiber,
yes,
right? And you also mentioned about fruits, and you also specified saying that not all the fruits, some fruits triggers. So any fruits you recommend to a hyperactive kid which helps in hyperactivity as well as in
see again, this is not for all the parents. Okay, when it comes to the, for example, it is an initial stage. We can give normal fruits, apple, bananas, these all we can. But when it comes to the going forward, these fruits might not be suitable. Why? Because fruits will contain the fructose. So this fructose indirectly will affect the brain. So like sugars, direct sugars. Okay. So I would say like apple would be fine. And papaya also, when it comes to the ripened, I don't think so. Will have contains more of sugars. Okay, and some kind of oranges. Oranges also sometimes it may irritate the gut. Based on the situation, we have to be placed. But I would say apple would be better option. The pomegranate and present seasonal fruits, which is we can say that itself. Upcoming mangoes, these all also will have a sugars, so it will triggers them. That's fine only, no problem. Watermelon at this time, I don't think so. Why? Because it's almost it is not ripened in a proper manner. And this is first of all, just think is that seasonal fruit or not. When it is unseasoned, that will contain the pesticides. That's what I can say.
And so as you're mentioning, the issues are not common about the kids, in specific to each kid, right? So is there anything you suggest for kids who are suffering with fits? Is there anything common for them regarding that?
So it's more into the, you're talking about seizures, right? No any other comorbidities like other issues, anything?
Um, they have issues with that issues.
Yes. So for these things, we need to be work upon a starting. Why? Because when we take a proper recall, generally how I do consultations, like just I wanted to explain why. Because how much time I like to take. Why? Because what's the history of the kid we should know. For this, almost it takes 1 hour of time. For a one consultation, I take 1 hour. For the initial consultation, I take. Maybe people may think like, why she has to take a 1 hour? But in that 1 hour, I am analyzing your kid. Okay, birth, when the mother is having the issues, when the uh, from the pregnancy to when the pregnancy contraindications anything were there or not, from there itself we need to be work. Okay, pregnancy, after birth, what's the weight of the baby, then what you have introduced for the baby, how much time you have spent with the baby, and who has taken care, these all will have a consent. Why? Because this entire history will reveals what was the root cause for this present scenario. That's how I usually work. So first of all, we need to be work whether it has to be gut or what is the main thing, and whatever the food you are giving, that may be one of the factor. These all things I need to be analyzed, right? So for this, it takes time. So that's how we need to be work. So any things we need to be pinpointedly work means you need to be ready to spend time. That's a very, very important. How much time you would like to. For me, I usually tell them, if you don't have a time, please don't come for a consultation. Why? Because when you are paying means it's you are paying attention to you or your kid, right? If you don't have a time, don't take a consultation. Why you wanted to unnecessarily spending the money, and at the same time just for a 15 minutes call? I don't think so, it will not work. First call, take a proper history, give a elaborate history to anyone you have to be spent, and then take a, then next call onwards it will be easy. Why? Because everything will be on paper, so it is easy to analyze the next call. Okay, so I really sorry I didn't answer to you, but the points whatever you need I have explained.
You spoke about that issue, right?
Yes.
Majorly one or three things. One is constipation, diarrhea, and bloating.
Yes.
Apart from these three, is anything else as an indication for that issue as a parent to know?
So these three are the major. Okay. And apart that, another thing is when the baby is not having the constipation, when the baby is not having the bloating issues, when the baby is not having the loose stools, still the baby is not growth. Then we need to be checked with the other parameters like iron deficiency, absorption capacity, and we are missing with some kind of vitamins. So that's what I'm telling you. Once we see the baby, when if the milestones were not up to the mark, like for example, within the 1 year of span, the baby growth is fine. For you guys, it might not be happy. For me, it is fine. So it changes everything when it comes to your point of view and my point of view.
Just to add on that, my son has a little chewing problem. When you feed him, mostly some snack will give it, but sometimes like fruits might not be able to smash it, right? So we just try to swallow. Will that one impact, or how does it work in consequences if it keeps not chewing much?
See, everything you are giving in a mashed format.
Not much, but because
But still, I am telling you. What does it mean? You're already either using the grinding or mashing.
It's like that. We chew but partially, not completely.
So first of all, we need to work on a swallowing. Why? Because whether the baby swallow people will be there. I'm not sure whether it's swallow therapy people will be there. No? Yes. So speech and the swallow, so the both followed by the same people. They will give you some kind of a therapies, like this is how you need to be follow for at home, or else when you are giving. Why? Because they will check with the swallowing parameters also. Why? Because whether the baby could able to chew or not, they will give a clarity on that. I'm really not supposed to be answer that question. Why? Because I'm not sure. These all once they will check and they will tell you whether the swallow, see, whatever we are feeding the baby, sometimes what happens, the parent is giving the direct smashed form, no? Their the mind will triggers that already the body is giving the direct food. Why I need to strain? So it will forgot the that mechanism. So that has to be initiated by the swallow therapist. So is that really triggering the same point or else anything else? I really not sure.
And sometimes because to me myself in childhood, in school also it is coming same like it is
Yes.
absorbing or not.
No, it's not absorbing.
Like sweet corn, like carrot boiled, he just he likes to eat, but fully he won't chew. So same
Yes.
with that and same in school it is coming.
Yes.
So that maybe absorbing the same nutrition side.
No, it's not absorbing. It means, for example, take a carrot pieces. If you're giving the carrot pieces, it will come like that itself. It will not absorb. Why? Because those acids are not melting them. So the nutrients are not releasing. Then it is no point of giving or like in that form.
So basically we want to make that బాగా absorb అవ్వాలంటే మనం ఏం చేయాలి? వాళ్ళు chewing అయినా లేకపోతే
See, when you are coming to the absorbency, his gut is not ready to accept this one. That is what the main symptoms, right? So first of all, we need to be work on that. So what we think, why? Because when the gut is more time nowadays, everybody is talking about gut and brain axis. Why? Because when your gut is not at all up to the mark, your brain axis, brain will not work. Why? Because the nutrients, everything released here itself, that is going to be released by, it's going to be released by the brain. So these releasing energy will utilized by the brain. So that's why nowadays everybody is talking about microbiota, gut axis, brain and gut axis. That's what the main concern is. So first of all, we need to be healthy with our guts. Then we can work on anything. See, gut is not healthy means we need to be work. That's it. No second option. There is no any second option. First of all, you need to be work on your gut. Then only you need to be given nutrients. So still you wanted to give in the similar way, it means you are unnecessarily wasting your time. For example, ఒక pot ఉంది, it has filled means it filled. Still if you are pouring means it's going to be waste of time. Waste of time and the waste of water. That's it. అంతే, మళ్ళీ మీరు ఎంత పోస్తున్నా కూడా still it's going to be unnecessarily. But you still you spending on the time means you're unnecessarily wasting your time.
next any snack packets we are giving a chocolate packet like basic no anything daily. Okay,
Packed foods, first of all, packed means think about it. It is ready to eat. When it comes to the ready to eat, preservatives will be there, right? It will gives you the triggering your sugars. So those things we need to be say no.
if home we are making good going on things
That's fine, no. What's wrong in it?
right?
No problem. They are kids. They are growing up. Then what's wrong in it?
And what are the sweets
Sweets we need to be check it out. Whether it's suiting or not, first thing. What kind of a sweets he is triggering. So those we need to be check it out and then we need to be introduced. That I cannot say it's 100%. And
most of the parents have been completely stopped eating the sweets which made of sugar
okay,
or jelly. Some of the parents are eating jelly, but yeah, but mostly they are completely stopped it because it might be the hyperactivity or the the high energy levels. So then is it fine because continuously they will do and suddenly they will reduce 1 or 2 times?
okay, I will answer to you. So, for example, I have stopped you something which is really like you are tend to that food. What will happens? You will crave for it. You will crave for it. At some point of time, At any cost, I wanted to take it in at any most. Instead of that, if you're taking small amount and giving the satisfactory to your body, how it will be? Different, right? Both will be different. It is triggering and it is satisfying. Both. So which one you would like to go?
Obviously, we will go to the satisfying condition only, but with that small amount, we cannot.
No. See, when you are giving in a small amount for a frequently, some point of time they will fed up. It doesn't mean it will, that is the only one of the triggering point. Okay. For example, you will think that that day environment, house environment is different. When it comes to the here environment is different, right? Here the most of the people will be little calm and the sounds will not be there, nothing will be there.
Mostly, it will be one on one. They will be settling.
Okay, when it comes to the home, how many people will be there surrounded by you? And the apartments nowadays, most of the apartments culture, and the outside sounds, everything will be trigger. We will think that is only the food. It's not. Just we need to be think whether those are also might be one of the factor.
Can we replace like with jaggery or dates? If at all
Jaggery is fine. Jaggery is fine. Dates are fine, but it should not be very high quantities.
once in a while they want to use
Yes,
We can replace it with small calories.
that's fine.
I feel like do
And again, I am telling you that will not be suitable for everyone. Please remember, some kids will be suitable, some kids might not be. They are immediately triggers. Some kids will not be triggered immediately. Please remember. So I would say now I'm telling you, just start these all things means after 2 to 3 days your kid will be triggered. Then you might be think, mom said like, see, this is the general scenario. I'm again the same point, but it is true. Why? Because that will suits or not be. We need to be checked. If it is suits, then you can continue. If it is not, immediately pause it.
even for meat products they need to check it.
Milk products, they can.
They need to check before giving an asking.
Yes, it has to be. Why? Because few people see all autistic kids are not irritated to the milk. Remember, it is not irritable to the milk. Sometimes diluted milk maybe helps him or she. Sometimes may not. It's all about the stage. So what kind of a scenarios they are going through, and the what time also we are giving. That is also one of the point.
And does it really affect with accreditation, branding, and what could be the thing?
This I couldn't able to answer, but as of my knowledge, I have seen few tags on packets like green. It will last for only 1 day,
Yeah.
and black or some blue. It will last for long time. It means the shelf life is increasing. So what I would say, whenever the shelf life is increasing means we are adding some kind of a chemicals to that.
Actually, I personally face problem with that. I ruled out that, and I started giving farm milk. There also uh, gave the insulin. Then I used to face the problem again.
Okay. In such situations, the milk, whatever the milk is coming to them, it is pasteurized or not.
Yeah.
Whether it is not pasteurized, that may be triggers. And whatever the normal వచ్చిన cholesterol, we usually call it as a cholesterol. That cholesterol will have a more of proteins. That also one of the major factor for the triggering the kid. So which one is, I am not sure, but it is triggering for that.
So, ma'am, I have a question. My daughter is 9 and a half. So, she is a picky eater. But she always want to eat outside food, packed foods like kurkure, chips, KFC chicken. But at home, she only use what she like simple dal rice, milk and chapati. And apart from this, she don't want to try anything new, like she don't want to eat fruits, vegetables, etc. So how to stop that fat food? Because I'm seriously fed up. Like always, because of that outside food, she throws a lot of tantrums, shouting, crying because of that food only, because she's craving for it. So how to stop that?
I would say like prepare similar things at home. First thing. And the another thing is just we need to stop going outside frequently.
Because now
Maybe yes.
we have three chapters also.
So first of all, we need to stop all these apps.
Phone and Zepto, Blinkit, whatever is there, just order it and go into school and supermarket. Let us stop here, have that and go. Even they are doing something good and we praise them like तुमने अच्छा किया है तो अब चलो snacks दिलाओ. If I have done something really good, so these are the problems.
See, first of all, we need to be tune the babies. First of all, for example, previously we used to go to the more times to the outside food. That might be habituated by the baby. Who has done that? We itself, right? First of all, when we started compromising, it might see as a parents, we have done whatever, but still in few scenarios we need to be compromised. I'm so sorry to say this, but still we need to. Okay, and first of all, when we see the WhatsApp, not in a WhatsApp, when you go to the YouTube, first of all it will shows the KFCs. So these all ads will come. Obviously, it is tempting for everyone. Obviously, even me itself, okay, it is fine. But when my brain will say is, it is a junk. It is a made up of maida. So why should I take? Why do I need to take when my brain is started thinking in such way? Immediately it will compromise myself.
Yeah, but that ability is not there.
No, it will not be there, but we need to be educated. That's what I'm telling you. We need to be educated. We will show the videos. See, recently I have seen some videos like creating a AIs with. So these are the foods are good for health. These are the so. Why don't you show those kind of videos to the kids instead of unnecessary stuff? Spending, see, for that it will takes time. Why? Because we need to spend the which are the good which are the good videos and which are the unnecessary videos. First of all, we need to be ruled out. If we spend and we are showing this is the maida and this is the made up of sugars and these all are triggering for the babies, then obviously when you are watching the same thing for a long time, they will realize some point of time they will realize. Only kids, why? Because kids will see the only those videos. Why? It is entertaining for them. So whatever the entertaining videos we are showing to them, then we need to be giving such kind of a content is also very important. It may be things. Yeah, thank you. It may be you might be say you are not in that zone. You are not in a parenting zone. So that's why you are talking means it doesn't mean. Why? Because I do counsel the parents like anything. You are the one and only parent. But I saw the multiple parents. It's not the parents, it's adults also I see. Even adults also will ask for a mom. Today I wanted to have one chocolate. I wanted to cheat. Today I wanted to go for a cheat. Instead of cheating, just take it, have in a small bite and happy. Just enjoy your thing and do your works. I would say that's the thing. That is how the patients we do counsel. How we counsel? Why? Because when the counseling is in a proper manner, when you are giving the proper inputs to the parents or the clients or whoever may be, whatever the inputs you are giving, that's a very important point. That's how we need to be worked. It's like, see, it's a mutual. It's not a one person. It's not a one-man show. It's like the both sides has to be. If I'm giving the 30%, you have to be work on 70%. If you are not working, things will not be on settled. So the see, it is like a mutual, and you need to be sit with the counselor, and you need to be talk to the doctors, and you need to be speak with the consultants, nutrition experts. Then only it's not a one day mistake. It's a long term mistake. Whatever we have done in the past, present consequence. For example, take example of just a minute. If a person is obese, what do you think? Is it one day or overnight thing? No, right? It's a long-term mistake. So for that, if you want to lose a weight in a 6 months or 3 months, is it foolish or else it is a good thing? People will say, I really want it. Okay, they will lose, but the contraindications also will be similar way. Okay, we should not target the short-term goals. We need to be take our long-term goals, and slow learnings, slow steps will gives you a good results, not a at a stretch. Take a time. If you not possible, take some time. Then take a call. That's how we need to be work. It is not a overnight, over month, over 3 months or 6 months. It has to be work like a long time. But the results will be there when you do it. And first of all, parents has to be very cooperative. How cooperative to your kid, the similarity will comes to you. When you anger, kid also will be anger. When you are cool, kid also will be cool. Whatever the environment, what kind of an environment you are giving to your kid, that's a very, very, very important. If you are feeding the baby with the anger, the baby feeding will be in a similar way. The baby think it in the baby brain also will think. You will see, you will watch the videos and you are feeding the baby brain will tune in such a way. Okay, next time also I can do the same way. Why? Because mama is doing the same thing, why can't I? So when you are doing that, impact, that will be at least 50% of impact will be on baby. You need to be understand where you are exactly. First of all, we need to be work on ourselves, then things will be get settled.
Ma'am, actually, I'm having my own. I don't know that it is related to this or not. My son is 8 years old now. We fixed one leave time and one pattern and all of it. That is okay. But he will give only picture.
See, throughout the day, for example, ఒక meal skip అయింది. For example, you didn't had the lunch yesterday. What have, for the same example I will tell you. Yesterday some place to some place, I didn't pack my food, just I packed some snacks, which is really not helpful to filling my gut. I had still, but it is not. By the evening, my brain started pain, headache started. I had tea. Still, it is not satisfied. Then I have tried some. Why? Because this is odd time to have the food, so I don't want to. I thought of like after 6:30, 7 o'clock, I will finish my early dinner and will go for a sleep early. Still, I have tried tea, which is not working. Again, the brain fog has started. Again, I had some kiras and the carrots. Still, my brain is not accepting, not at all accepting. Then immediately, I rushed to the kitchen, had some food, afternoon, whatever the leftover was there. I had some with గోంగూర పచ్చడి ఉంది మంచిగా కలుపుకున్నా added some ghee and had that time by 6:30 or 7 o'clock. Later on, it hasn't triggered anything. Even I didn't had the dinner also. Why? Because whatever the food you are giving that, it will satisfy. It should be satisfied to your brain. I had tea, still it is not satisfied to me. Even I had a kira and carrots, still it is not. Salad I had, still it is not at all. Then immediately I took some kind of rice with some good amount. Then immediately have started my work and have finished my remaining things, whatever the PPT leftover work was there, I've completed, and then I have shared it to by 9 o'clock or 10 o'clock to her. That's how the things will go. See, I'm a normal person and I know what is it exactly. Everything I know, but still I skip the meal. I know that's a wrong thing, but the scenarios has been given the situation, created the situation. Still, I couldn't able to resist that. So done. So even a normal person, for me, it is showing in me such a way. For a kid, how it will be? Tell me. It's obviously it will shows. So you have given a pattern to him, like tuning the brain. That's a good thing actually. Whenever you are going out, just pack some curd rice or something else. That would be better option. And anything?
Now, what if these kids have their mind satisfied with the bad food?
Why? Because we are showing more time. When we come to the street, chips will show. When we go, see the brain, we are giving such kind of a climate. For that, I'm not the reason, but still the circumstances. See, when you are going in a fruit street, your brain will ask for fruit itself. When you are going for a junk, obviously it will
But then they will use their brain, they will
immediately.
they will enter
Why? Because in apps, in our phones, everywhere the advertisements. See why the people are spending more on advertisements. Why they are giving that much of amounts to they are paying to the some few people. Why? To attract all these things. First of all, government has to be banned on all these things. See, we couldn't say that, but it is one of the major drawback that in few states, it's not a few states. Recently, some villages are making them like ice creams, trolleys, or something, whatever they are saying. When you are entering into the village, you have to be pay fine 5,000. 6,000. So when you are paying, then you will know the value of it. So recently I have seen somewhere, some village as entirely, they have clearly pasted a banner like, you should not enter into this village. Like ice cream trolleys and some candies, whatever they are showing. So these all, they have, I felt so happy. Why? Because those people were aware those are the main culprits for the issues, right? So those kind of things we need to see. When it comes to the our thing, then only we will realize It is not for the others. When it happens to the others, we don't know the pain. When it comes to ours path, then only we will know. Instead of that, we need to be tell them. So these are the thing already together and do the. That's why the people, the government also. Why these are the cancer days? These are the tobacco free days. Why it is like government is giving the inputs when people are not accepting that, then it's a drawback from our side itself. I don't blame the government. Why? Because we are them. For example, for the smoking cigarettes are there. Why? Because the already they are buying and they are, it has to be like a turnover for them. If the cigarettes are not turning over, then they will place with something else, right? If the industry is closed, they'll plan for something else good thing. So that's entirely our inputs. Whatever we are doing, people will think I am the one and only person smoking them. Same the thing will repeat it for the many people. So that's how the industries are going on. So we can educate few people, can't all. First thing, we need to be think our zones, which we are safe or not. Then we need to educate. Even though in a communities also, when it comes to the these are the wrong thing. See, when it comes to the outside to the community, they will show the they will place with a good amount of ice creams, pizzas, burgers. Everything is they are placing means immediately when we are out into the community, it is available. Then immediately we will go. Anyone will go. So first of all, we need to stop from our side. Then we can think about the outside. సో ఏదో ఒక సామెత ఉంటుంది, ఇంత గెలిచి రచ్చగలవాలి అని. సో దట్స్ అ వ్యాలిడ్ పాయింట్. సో ఫస్ట్ ఆఫ్ ఆల్
అయితే దాన్ని ఫుడ్ ప్రాపర్గా మోర్ దెన్ టేకింగ్ యాక్చువల్గా సంబడి ఒక 50 grams అని పెట్టాలనుకోండి, ఫోన్ చూస్తా ఏదో టీవీ చూస్తే చాలా లాంగ్ టైం ఉంటుంది. అది తన ఇష్టమైన ఫుడ్ వేస్తే తన ఇష్టం లేకపోయినా సరే కంటిన్యూగా తింటూనే ఉంటుంది అన్నమాట. ఒక 50 minutes ఇంట్లో అయితే ఓకే, స్కూల్లో కూడా అదే టైం ఇస్తుంది, కానీ వాళ్ళు టైం అయిపోతుందని నోట్లో పెట్టేస్తారు.
See,
కానీ
you are
అలా తింటాం అన్నా ఇంట్లో పెద్దవాళ్ళు ఏమంటారంటే పేరెంట్స్ కూడా దాంట్లో రెకమెండ్స్ వెళ్ళిపోతారు, అది సపోర్ట్ ఫాస్ట్ ఎంత చెప్పినా అది స్లోగా అది వెళ్ళిపోతుంది. కరెక్ట్.
see, that's a valid point అండి. Whoever telling you, that's a really valid point. So when
స్లోగా తినండి, చూపించేస్తుంది బాగా ఓన్లీ తినండి.
see, that doesn't mean take a 1 hour. అంటే చేయండి అని చెప్తున్నారు కదా అని it should not be like 1 hour or 2 hours. And the another mistake is you're giving the meal time at the meal time lo you are giving the phones, right? So stop the giving the phones and play with some games. See, already brain has tuned andi. Tanaki already brain has tuned. Just for a food I need to take this much of time. So obviously she will take the same thing. See, ఇది ఒక రోజు mistake కాదు. That's what I'm telling you. You need to be slowly switch off all these things. స్లోగా మీరు స్విచ్ ఆఫ్ చేస్తూ చేయాలి. మీరు ఒక్క రోజు నేను ఫోన్ తీసేస్తాను, 2 రోజులు తీసేస్తాను. నార్మల్ పర్సన్ కి కూడా ఇఫ్ ఎనీథింగ్ టు హ్యాబిచుయేట్ యూ నీడ్ టు బి వర్క్ ఆన్ 21 days at least. Then your brain will start working on the same thing. After 22nd days ఈ మధ్యలో ఎప్పుడైనా కూడా just if you are skipping something, then your brain will not accept. Even though the gymming or else you wanted to do something yoga, do it for it should not be Sunday. It should not be Saturday or it is for today holiday. It is not. You have to be work for continuously 21 days.
చూసి my brain is no accept. Really count and pay.
Do that. Why you instead of giving the phone and just habituate feeding the baby early and then give the phone.
And then
So that's how.
ఒకే బండిలోనే 4-5 items fruits ఉంటుంది. Can we eat like that?
Oh, that's fine, no problem. What's wrong in it?
Actually, you'll be very
It will trigger her. No, it will trigger her.
simple foods.
That will trigger her.
Okay.
It will trigger her. That's what I'm telling you. It will trigger her.
యాక్చువల్లీ నా సిచ్యువేషన్కి విటమిన్ డి డెఫిషియన్సీ చాలా ఎక్కువ పాపకి. అయితే ఇప్పుడు సెక్షన్ రావడం కూడా యాక్చువల్లీ విటమిన్ డి సిరప్ డైలీ వేస్తాను అనమాట. మార్నింగ్ బ్రేక్ఫాస్ట్ బిఫోర్. అయితే అది కంటిన్యూ చేసాం ఒక 1 వీక్. కానీ మళ్ళీ చెక్ చేయకుండా మళ్ళీ విటమిన్ డి సిరప్
See, deficiency means absorbency is not there. You are giving, but it is not absorbing. You're giving the medicines, but it is not absorbing. That's what the main thing is. Meremistunaro, it's losing. It's not absorbing by the gut. That's why the deficiencies are. First of all, we need to be work on the gut health issues, ma. Then only we can do anything else. Sorry? Through food. See, changes. It's like మనం ఫుడ్ ఇచ్చేది చాలా ఇంపార్టెంట్. వాట్ ఎవర్ ద ఫుడ్ వి ఆర్ గివింగ్ టు ద కిడ్స్, దట్స్ అ వెరీ వెరీ వ్యాలిడ్ పాయింట్స్ అండ్ వెరీ వెరీ ఇంపార్టెంట్.
my son takes it. Whatever he asks, he will ask relatively only, not himself. వాడు అడిగింది పెడితే నమ్ముతాడు, మనకు నచ్చింది పెడితే నమ్ముతాడు.
Obviously it will be there, ma. I don't think so it is a valid. Why? Because obviously he wanted to enjoy his food, so that's why he's chewing.
We don't know.
Obviously, otherwise వద్దనుకుంటే డైరెక్ట్లీ గల్ప్ చేసుకున్నాడు. అందులో తప్పేం లేదు మా.
Is there any supplement powder which we can give to our kids which can replace all these?
See, that we have to be check it out. That we need to be check it out. I couldn't able to say. See, this is not the prescription which will helps to the same.
Yeah. Can we go with normal blood test or vitamin test to check out or food? Food ద్వారా नहीं होगा. Blood वाला होता है.
So first some food allergic test will be there. If it is really requires, then we will suggest. Otherwise, we will see the kid ma first of all, then we will decide whether this is going to be suits. Why? Because after 2 weeks or 3 weeks, after 1 year again you have done the same test, it may be changes. Why? Because gut might be repaired these many days, then so it's depending on the situation and the requirement. That's it.
ఇంత టైంలో రియాక్షన్ అనేది ఇంత టైం సస్టైన్ అవుతుంది. సో ఆఫ్టర్ దట్
It's depending on the food what you are giving. 1 hour లో ఉంటుంది రియాక్షన్, విత్ ఇన్ 15 minutes లో కూడా రియాక్షన్ ఉంటుంది. ఉంటుంది బట్ ఇట్ మే ఆర్ మే నాట్, వీ నీడ్ టు బి కన్ఫర్మ్. For example, you have given the allergic food to the gut. It will check నేను capable లా కాదా అని చెక్ చేసుకుంటూ ఉంటుంది. That you will get to know in the after 1 day. That's once if we take the history, then we will get to know. Or maybe sleep ఉంది, sleep proper గా లేకపోయినా they will trigger obviously. You are giving the disturbed sleep, then it will obviously.
Because మా బాబుకి షుగర్స్ హైపర్ అప్రోచ్ చేశాను. సో వి అవాయిడెడ్ ఇట్ కంప్లీట్లీ. దెన్ లాస్ట్ మంత్ onwards we started a cheat day only once. Last time it was okay, but this week every day, that day he was fine. Next day afternoon onwards I somehow felt he became hyper.
Yes. Why? Because once he have done the cheat day, he will crave for that 1 month. ఎప్పుడు ఇస్తారు అని స్టార్ట్ చేస్తారు. That's what I'm telling you. Just if please don't exclude everything. These people are not at all like, why you wanted to show it's like he is a special kid. Let them, they will not have anything. Just if you are serving everything in a one plate, they couldn't able to have one spoon, you know that.
అందరూ చూస్తున్న పేరు రాకుండా షుగర్ చక్కెర పడినంత మాత్రం వాళ్ళు నిద్ర అవుతున్నారు.
ఉంటుంది మా
అది కంప్లీట్ గా అంటే ఒక స్టేజ్ వచ్చి మేనేజబుల్ వచ్చారు. స్లోగా కొంచెం కొంచెం ఇంట్రడ్యూస్ చేద్దాము అనేసి లాస్ట్ వన్ చూస్తాం.
no
2 days తర్వాత రియాక్షన్ కలుగుతుంది. ఇఫ్ ఇట్ ఇస్ రిలేటెడ్ టు ది సేమ్ థింగ్ మేబీ
sugars always triggers. Sugars always, refined sugars always trigger. Remember, that's not the only one thing. It's always.
అంటే మనం దీన్ని ఎలా ఉంటారు అంటే మా వైఫ్ ఫీడింగ్ చేస్తుంటే చాలా ఎక్కువ టైం తీసుకుంటారు అండ్ ఒక టైంలో తను ఎడ్యుకేట్ అవుతా ఉంటారు. సో హౌ అంటే మన ఇంట్రాక్షన్ ఎలా ఉండాలి అనుకుంటున్నారు?
See, that's what I'm telling you only. First of all, మనల్ని మనం ప్రాపర్గా పెట్టుకోవాలి. ఫర్ ఎగ్జాంపుల్, we need a counsel, not a kid. First of all, kid తో ఇంటరాక్షన్ అనేది when your mood swings are changing and everything, see, that impact will be on kid for sure. 100% ఉంటుంది. ఎందుకంటే మనం ఇరిటేట్ అయితే వాళ్ళు కూడా ఇరిటేట్ అవుతారు. మనం తింటుంటే వాళ్ళు తింటారు. మనం ఏం వాళ్ళు ఏం తింటున్నారో మనం అది తింటే ఓకే, సేమ్ ఫుడ్డే కదా తింటున్నారు, నేను తింటున్నాను అని చాలా సేఫ్ గా తింటారు. సో ఇట్స్ లైక్ మ్యూచువల్ అండర్స్టాండింగ్స్. హస్బెండ్ అండ్ వైఫ్ మధ్యలో ఎట్లాగా మ్యూచువల్ అండర్స్టాండింగ్స్ ఉంటాయో, మనం కిడ్స్ తో అంతే మ్యూచువల్ అండర్స్టాండింగ్స్ పెట్టుకోవాలి. ఒక దగ్గర కాంప్రమైజ్ అవ్వాలి, ఒక దగ్గర ఇట్స్ ఓకే ఫైన్ చేస్తాం. సి మీరేమో ఫుడ్స్ ఆయనకి ట్రిగరింగ్ ఫుడ్స్ ఏమైనా ఇస్తున్నారేమో. See, you are thinking that is not triggering, but he might be triggering. See, మీరే అంటున్నారు మిగిలిన ఏ విషయాలు is not triggering, only triggering with the food. Maybe that's wrong ఏమో. చూడండి, అలా చూడండి. ఒక see, what we assume, whatever we are giving, it's a good, but sometimes it will trigger him. మీరు ఒకటే ఫుడ్ ని రిపీటెడ్ గా ఇచ్చేటప్పుడు ఆయన ఏమనుకుంటారు, ఓకే తినొద్దు, నాకు సేమ్ ఫుడ్ అని చూసరికి ఆబ్వియస్లీ ఇరిటేట్స్ మీ, రైట్? సో ఇన్ ద సిమిలర్ వే మేబీ తనతో ఏమైనా అవుతుందేమో, ఒకసారి చెక్ చేయండి. దట్స్ వాట్ ఐఎమ్ టెల్లింగ్ యూ. లైక్ ఒకసారి చెక్ చేసుకోండి. సో బేస్డ్ ఆన్ దట్ యూ కెన్ ప్లాన్. ఆ క్రేవింగ్స్ ఉంటాయండి వాళ్ళకి, సాల్ట్ క్రేవింగ్స్ అండ్ సోర్ క్రేవింగ్స్, స్వీట్ క్రేవింగ్స్, ఇవి ఉంటాయి. సో దట్స్ వీ హ్యావ్ టు బి కాంపన్సేట్. అంటే ఫుడ్ లో మనం కొంచెం కాంపెన్సేట్ చేస్తే దట్ విల్ నాట్ ట్రిగర్స్ మచ్. సి మిల్లెట్స్ ప్రాసెసింగ్ ఏం చేస్తున్నారో నాకు తెలియదు. అది చెప్తున్నాను చూడండి. మిల్లెట్స్ ప్రాసెసింగ్ ఉంటుంది, దాంట్లో యాంటీ న్యూట్రియంట్స్ ఏమైనా ఉంటే దట్ విల్ ట్రిగర్ ద రిమైనింగ్ న్యూట్రియంట్స్ అబ్జార్ప్షన్. excuse me 2 minutes. So that will be triggers. Okay, so whatever the food we are giving, it has processed properly or not, we need to be check it out. That's what I'm telling you, how far it is good thing nowadays. లేదండి, నేను నా దగ్గరికి చాలా మంది నేను ఆర్గానిక్ చేస్తున్నా అని వస్తారు. బట్ ఐ యూజువల్లీ ఆస్క్ దెమ్ వాట్ ఈస్ ద ప్రాసెస్ యు ఆర్ గోయింగ్ త్రూ. నాకు అది ఇస్తే నేను అప్పుడు ప్రిస్క్రిప్షన్ రాస్తాను. ఎందుకంటే వెన్ ఐ షుడ్ హ్యావ్ అ కాన్ఫిడెన్స్ ఆన్ దాట్ వెదర్ ద ఫుడ్ ఈస్ సేఫ్ ఆర్ నాట్. అలా నేను మీకు అదే అంటున్నానండి, అది మనకి చెప్పరు, మనం ఒకసారి మొత్తం చూడాలి. అసలు అది ప్రోడక్ట్ ఏంటి, దాని మీద కొంచెం మనం వర్క్ చేసుకోవాలి. చేసుకొని అప్పుడు మనం సేఫా కాదా అని యూస్ చేసుకోవచ్చు. ఇప్పుడు ప్రజెంట్ అందరూ మిల్లెట్స్ అని అంటున్నారు. ఇప్పుడు మిల్లెట్స్ వెయిట్ లాస్కి స్టార్ట్ చేస్తారు, వాళ్ళకి సూట్ అవ్వదు. వై? బికాస్ దట్స్ నాట్ ద ప్రాపర్లీ అంటే ఒక వేలో వెళ్ళినవి కావు. ఒక్కొక్కసారి ఆ మిల్లెట్సే వాళ్ళకి యాంటీ న్యూట్రియంట్స్ అయ్యి అన్నెసెసరీ థైరాయిడ్స్, ఓకేనా, పీసీఓడి ఇష్యూస్ ఇలాంటివన్నీ స్టార్ట్ అవుతాయి. సో ఇప్పుడు నేను ఆ విషయం అప్పుడు నాకు ఎప్పుడు వాళ్ళు ఆ హిస్టరీ మొత్తం ఇచ్చిన తర్వాత దెన్ ఐ కెన్ రియలైజ్ దీస్ ఆర్ ద థింగ్స్. సో ఇమీడియట్లీ ఐ ఆస్క్ దెమ్ టు స్టాప్ ఆల్ దీస్ థింగ్స్. వి విల్ షిఫ్ట్ టు ద నార్మల్ డైట్ అండ్ విచ్ ఇస్ రొటీన్, దెన్ వి విల్ స్టార్ట్ ఆల్. సో అది నేను మీకు చెప్పలేను కదా. ఇప్పుడు మీరు వచ్చి పలానా ప్యాకెట్స్ నాకు చూపించి ఇది ఎక్కడి నుంచి వచ్చిందంటే ఐ కుడెంట్ ఏబుల్ టు ఆన్సర్ దట్. వై? బికాస్ ఐఎమ్ నాట్ ద మ్యానుఫ్యాక్చరర్. If I am the manufacturer, so these are the procedures I am following. So this, which is really safe for you, just you can use it and then prescribe cheyochu. Which I am not doing all these works, so I couldn't able to.
But issues for the fevers and food
Immunity, yes, immunity అన్నది ఒకటి. ఫుడ్ ఇండైజేషన్ అవ్వడం వలన థర్మల్ ఎఫెక్ట్ ఉంటుంది.
because I observed and I
థర్మల్ ఎఫెక్ట్ అయితే ఉంటుంది. ఫర్ ష్యూర్ ఇట్ విల్ బి దే. మళ్ళీ నేను అదే రిపీట్ చేస్తున్నాను, విచ్ ఈజ్ రియల్లీ నాట్ సూటబుల్. అది ప్రాసెస్ ప్రాపర్గా అయిందా లేదా అన్నది చూసి it's fine, it's fine, fine, no problem. ఉంటుంది 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 ఒక్కొక్కటి నేను చెప్తున్నా, ఫుడ్ కి ట్రిగరింగ్స్ అనేవి చేంజ్ అవుతాయి. సో దట్ విల్ హ్యావ్ అ మోర్ ఆఫ్ ఇంపాక్ట్. చెప్పలేమండి. ఫుడ్ at the same, mostly 24 hours to 48 hours reactions will be there. After that వచ్చిందంటే we need to be checked. May not be.
Seriously, some foods, my son I observe, కొన్ని ఫుడ్స్ నైట్స్ అట్లా ఇస్తే ఇది నాట్ స్లీప్.
అవి ట్రిగరింగ్ అవుతున్నాయి అనే దాని అర్థమా?
If I give sugar after 6, he'll not sleep properly.
అదే నేను మీకు చెప్తున్నా, వాట్ ఎవర్ ద ఫుడ్ యు ఆర్ గివింగ్, ద టైమ్ అండ్ ద ఇంటర్వెల్స్, దట్ విల్ ఎఫెక్ట్ లాట్.
మళ్ళీ ఆ ట్రిగర్ అయ్యి అన్ని రెస్ట్ something or the other
has to be done.
Madam, supplements to sustain కొత్తగా ఫోలిక్ యాసిడ్ అనాలిసిస్ అని చెప్తున్నారు.
ఫ్యాట్ అనాలిసిస్ ఎవరికి?
మామూలుగా ఆఫీసర్కి లేదా ఫ్యాట్ అనాలిసిస్ టెస్ట్ చేసి ఫోలిక్ యాసిడ్ చేస్తారు.
నాకైతే తెలియదు. జస్ట్ ఐ నీడ్ టు వర్క్ ఆన్ ఇట్. ఐ రియల్లీ డోంట్ నో దట్. వన్స్ ఐ నీడ్ టు బి.
బాగా సజెస్ట్ చేస్తున్నారు,
నేనైతే దాని మీద వర్క్ చేయలేదు, టు బీ ఫ్రాంక్. అదైతే నేను ఒకసారి వర్క్ చేసి ఐ కెన్ ఆన్సర్ యూ, బట్ ఇప్పుడైతే నేను ఆన్సర్ చేయలేను. ఐఎమ్ సో సారీ.
Some of the foods are right now going on this trial basis, experimental basis. Since some of the foods are already in the starting only, some of the diets are not first time. As they could get in the so some things researchers are going on from the start of the trial basis to start chasing. So we have to see whether it will be
out. See, those all under trials. It's, see, even though నేను స్లైడ్స్ లో కూడా మీకు మెన్షన్ చేశా, ఎవిడెన్స్ ఇస్ మిక్స్డ్ అని. ఇట్స్ నాట్ ద స్పెసిఫిక్ ఫ్యాటీ ఫుడ్స్ అన్నది నేను చెప్పలేదు మీకు. ఎందుకు అని అంటే ఓన్లీ మనం ఫ్యాట్ మీద కాన్సన్ట్రేట్ చేస్తే రిమైనింగ్ థింగ్స్, వెర్ ఇస్ ద ప్రోటీన్ మీకు ఎక్కడి నుంచి వస్తుంది, అండ్ ద ఎనర్జీ వేర్ ఇట్ విల్ కమ్స్. సో ఐ డోంట్ థింక్ సో. నేను అలా అని చెప్పి ఇప్పుడు ప్రెసెంట్ ఆన్ గోయింగ్ రీసెర్చ్ అయితే నేను ఐ కుడెంట్ సే ఇట్స్ రాంగ్. మేబీ ద ట్రయల్స్ ఆర్ అండర్ ట్రయల్స్, మేబీ దాన్ని బేస్ చేసుకొని దీస్ ఆర్ ద ఎవిడెన్సెస్ ఆర్ షోయింగ్ దీస్ కంప్లైంట్స్ ద స్పెసిఫిక్ ఓన్లీ ఆ టర్మ్ లో అంటే ఆ స్ట్రీమ్ లో ఉన్న వాళ్ళకి మనం యూజ్ చేయొచ్చని. మేబీ ఇఫ్ దే ఆర్ గోయింగ్ టు బి ప్రూవ్ దెన్ వీ కెన్ స్టార్ట్ దట్.
నేను మామూలు యూట్యూబ్లో అలా చూసానండి, బట్ మన పేరెంట్తో నేను ఇంటరాక్షన్ అవుతుంది కదా. సో ఈ బాబాయ్ 2 years 3 months వాళ్ళు టైంకి వెళ్తే ప్రాక్టికల్ టెస్ట్ సజెస్ట్ చేశారు. అండ్ వెన్ ఈ టర్న్ అవుట్ ది ఫాస్ట్ ఒక కొత్త, నేను ఎప్పుడు వినని ఫోలిక్ యాసిడ్ విన్నాను. ఫోలిక్ యాసిడ్ అని ఒక సప్లిమెంట్ ఇచ్చారు, అది సజెస్ట్ చేశారు చిన్న పిల్లలకి అని చెప్పారు. అది ఎంతమంది రిలేబుల్ అనేది.
See, fat analysis, I'm so sorry to interrupt you. Fat analysis చేసినప్పుడు మనకి మోషన్ లో ఏమన్నా అన్నెసెసరీ ఫ్యాట్స్ ఏమైనా రిలీజ్ అవుతున్నాయా లేదా? ఓకే, FRAT. ఐఎమ్ సో సారీ, నేను మీరు ఫ్యాట్ అంటున్నారేమో అనుకుంటున్నాను. ఓకే, నాకు అది అంత తెలియదు. యా, బట్ స్టిల్ ఇఫ్ ఐఎమ్ నాట్ వర్క్డ్ ఆన్ ఇట్ నేను మాట్లాడలేను. ఎందుకంటే ఇఫ్ నేను వర్క్ చేశాను అనుకోండి మీరు అన్నది, దెన్ ఐ కెన్ స్పీక్ అవుట్ సంథింగ్ విచ్ ఇస్ రియలీ నాకు తెలియంది నేను ఇది ఇంటరప్ట్ చేసేసి చెప్పేస్తాను అంటే ఇట్స్ నాట్ ద గుడ్ థింగ్ ఫస్ట్ ఆఫ్ ఆల్. ఎందుకంటే మనం ఏది కన్వే చేస్తున్నామో ఇట్ విల్ గోస్ టు ద ఆడియన్స్. వై? బికాస్ ఇట్ విల్ స్టోర్ ఇన్ దైర్ మైండ్స్. So that's very, very important. When we are tuning the mothers or fathers, it has to be clear. అంతేగాని మధ్యలో పెట్టేసి మనం డైలమాలో పెట్టడం కరెక్ట్ కాదు.
Any other problems by this also? Yes, I told you already. The singular number, you can take the appointment, okay, or you directly with the message or the instant appointment is for you can this number reception is available.
Okay, thank you so much.
Just a
Thank you so much.
Thank you for coming, everyone. Bye.
మైక్ ఇచ్చిందా?